Tariq RYK. Let's talk today at our topic. Today we will discuss the most important MCQs mostly appeared in the annual exam. That we topic is today BP regulation, how our body regulate our blood pressure after an accident, injury or some hypoxic condition. Be connected and learn more. Let's start our topic. First question is maximum feedback gain in the controlling BP. So see the options. There are four options. You will choose correct one. First option baroreceptor, second chemoreceptor, third one is the renin angiotensin aldosterone system, fourth one is the CNS ischemic response. So the correct one is the renin angiotensin aldosterone system. Next, decreased angiotensin level is due to how angiotensin level is decreased. First option decrease extracellular volume, second option increase sodium ion delivery to the distal convoluted tubules, third one is the increased extracellular volume, and fourth one is the increased renin. So the correct one is increased extracellular volume. Next, renin is increased by which of the following? How renin increased its secretion? First one is increased potassium, second increased magnesium, third one is the increased sodium, and last one is the decreased potassium. Renin will control the decreased potassium level to make it normal. The fourth, when total circulating volume decreases, what will be the most important change in the kidney to preserve blood volume is? When the total volume circulating is decreased, which be the most important change in the kidney to preserve more blood? See the options. First one is the decreased antidiuretic hormone secretion, second increased renin secretion, third increased blood flow to the medullary interstitium, and the last one is the decreased renin volume. So first answer is the increased renin secretion. Next, RTA, renal tubular acidosis. The blood pressure is 80 over 40 mmHg. So that is the hypotension, tachycardia, low urinary output after catheterization. Renin was increased in this condition. How renin get increased? Renin was increased due to decrease in, let's see the options. First one, decrease in the arterial blood pressure, second option decrease in the arterial blood flow, third option increase in the arterial blood flow, and last one is the increase in arterial blood pressure. So the correct one is the decrease in arterial blood pressure. Next, how renin angiotensin aldosterone system regulated blood pressure in the long terms? The long terms regulation our RAS mechanism is used. So the first option vasoconstriction, second option activating aldosterone release, third one is the releasing nitric oxide, fourth one is the activating ADH receptor. So the correct one is activating aldosterone release. Next, the most potent stimuli for the aldosterone release is, for the most cause the release of the aldosterone is, see the options. First option renin, second option adrenocorticotropic hormone, third one is the hypokalemia, or fourth one is the hyponatremia. So the correct one is the renin. Next, a young patient's blood pressure is 150 or 95 mmHg, hypertension. His serum renin level is higher than the normal. Which of the following is the most powerful stimulus for the renin release? Let's see the option. Essential hypertension, increased delivery of sodium ion to the renal tubules, third is the increased blood flow to the kidney, and the fourth one is the increased sympathetic stimulation via the renal nerves. The correct one is the increased sympathetic stimulation. Next, during exercise, high sodium retention is due to, when a person exercise, its sodium level increased. How it is increased? See the reason. First one is the RAS mechanism, second parasympathetic activation, third one is the HPA, hypothalamic pituitary adrenal, and last one is the none of the above. So the correct one is the RAS mechanism. Next, kidney release renin in response to following. When kidney release its renin hormone, see the condition. So the first option is the hypokalemia, second is the hyponatremia, third is the hypercalcemia, fourth one is the hyperglycemia. So the correct one is the hyponatremia. Kidney release renin when there is a low sodium. Next, short term response to the blood pressure regulation is, for long term we remember that was the RAS mechanism, but we see in the short term. Let's see the options: ADH, RAS, baroreceptors, CNS ischemic response. So the correct one is the baroreceptors. Next, immediate and transient potent action of the angiotensin 2 is, the action of the angiotensin 2 is, see the options: first, vasodilation; second, diuresis; third, aldosterone release; fourth one is the vasoconstriction. So the correct one is the vasoconstriction. Angiotensin 2 causes the vasoconstriction of the arterioles. Next, long term arterial blood pressure is controlled by, for long term we remember that there was the renin-angiotensin. So, and second option vasoconstriction, third is the vasodilation, and fourth is the baroreceptors. Baroreceptors was for the short term, for long term is renin-angiotensin. See the next, angiotensin 1 is converted to the angiotensin 2. Angiotensin 1, where it is converted to the angiotensin 2, in which part of the body, in which organ, see the location. First option, kidney; second, lung capillary endothelium; third, liver; fourth, none above. So the correct one is the lung capillary endothelium. Next, decrease sodium chloride to the macula densa cause, when there is a low sodium chloride in the macula densa, which will happen. So see the option. First option, release of the erythropoietin; second, release of the aldosterone; third option, release of the renin; fourth option, release of the vasopressin. So the correct one is the renin, because we remember the renin control the sodium level also. So next, which of the following is the immediate effect of the renin angiotensin system? So the immediate effect of the RAS mechanism is, first option, release of the ADH; second, release aldosterone; third is the thirst stimulation, and the last is the arterial constriction. So the correct one is the arterial constriction.
So thank you for watching these videos. Be connected with us for further more detailed informations about the national licensing exam MCQs, and we will try to record the most important MCQs that are already come in the uh, exams. So thank you so much for watching this video, and be connected, be subscribed, and share also this video. Thank you so much.